joining me to unravel what this means for our Christmas is infectious diseases specialist Professor Peter Collignon from the Australian National University. Professor, good evening and thank you for joining us at this time of year.
Thanks for having me.
Pleasure. Well, what are we to make of this? The numbers down today, but clearly as an epidemiologist, I guess you'd be saying there could be a lag time, there could be a lag indicator on this. Is that a fair assessment?
Well, I think it's true. This is a good sign that it's 15 today, but we've got to see what tomorrow and the day after and the next few days after that shows. If this is under control, I'd expect a little bounce of the numbers, might see, 20, 15, but it'll keep on going down. And in a few days' time, at least after 5 days, which is the median incubation period, we should start seeing much lower numbers. And specifically, we should only start seeing cases in people who are already in quarantine. As far as we can see, this is a cluster, which means all the people identified have got a link with some of the others. And what that also means is all the close contacts should already be in isolation or quarantine. So they shouldn't represent a risk to the rest of the community when and if they come down with an infection. What's more of a risk if we find there's cases that don't have a link and are just still walking around the community. It's bad enough if they're actually known with a known case. But where there's a real problem is the mystery cases. In other words, the ones that you find in the community where you don't know where it came from. And that would particularly be an issue if you found them in, say, Parramatta, Blacktown, other areas of the northern beaches. So far, there's no evidence of that. And the indications are this is a cluster, a bit like what happened in South Australia a month or two ago. So it should stay confined and we should be able to get control of it, particularly because this is summer and respiratory viruses, while they obviously spread, they do so with less vigour and less efficiency than if this was in July or August.
Gotcha. Now, Professor, correct me if I'm wrong, but did they find patient zero in this particular case? There seemed to be some speculation in the media that that had not occurred as yet. Is that the case?
Well, I don't think patient zero has been found. This seems to be a strain that came from the US, but there's a lot of people come back from the US that may have the strain that might be in hotel quarantine. It suggests it wasn't lying there silently for the last couple of months and then resurrected. It suggested that this did actually come out of somebody who went into hotel quarantine or came back from the overseas, such as a flight attendant or something, etc. But
Gotcha.
the important thing is that all the other cases are linked, as far as I can tell from what's been put out in the media. And that actually suggests that it is much more likely that they'll get control of this within a reasonable period of time, meaning the next, 4 to 5 days or a week.
So the likelihood that the so-called asymptomatic transmitters are currently travelling in regional New South Wales, for instance, we should draw some comfort that's probably not happening. Is that a fair inference?
Well, we can't say it won't happen or isn't happening, but there's a very low likelihood. And we've got to remember to put this in perspective. This, in some ways, is less of a risky infection than the Crossroads problem we had with many more cases and the subsequent cases in our winter, where there is much more likelihood that it will be transmitted. And you might remember, while there was some transmission, I think, to Bateman's Bay, and it did go to regional areas, it didn't spread. And particularly it didn't spread to, say, Canberra, which had open borders with New South Wales at the time in winter, nor, in fact, to other states. The spread that occurred previously was from Melbourne, which had uncontrolled community transmission at the time. That came to New South Wales. There was also a cluster in Queensland and also some cases actually in the ACT. So that all came from Melbourne.
Yes.
So that is a much higher level of infection than appears apparent in Sydney at the moment. And also it's in a season, winter, where it's much more likely to spread. So at the moment, I'm reasonably optimistic with what the New South Wales government has done, which is sort of a lockdown of sorts of the northern beaches where there are the cases, and more restrictions in the rest of Sydney. I would hope that would be very successful, but I guess time will tell. And it'll also tell us whether, like, in fact, what I believe the South Australian reaction was an overreaction with particularly all the closure of the borders, because all the cases that were found in retrospect were known by the contact tracers and they were in isolation or quarantine when they developed their infections. And this may end up being the same, that this is an example where you've got good contact tracing, good cooperation of the community, mask wearing where it's a high risk, public transport indoors, because indoors is such much more of a risk than outdoors. That should control this, but we'll have to wait and see. But it means everybody in Sydney is going to have a few more restrictions for a period of time, probably over Christmas, but we'll just wait and see.
All right, just to close on it then, one of your colleagues talked about the real risk of a super spreader event around Christmas, New Year, Professor McIntyre. You're not as concerned about that. I don't wish to draw you into controversy with a colleague, but it was running in both major national mastheads today, and it did send some alarm bells, I suspect, through people thinking about things like carols on the Domain, for instance, and other events.
Well, there's no doubt that a lot of people get together at Christmas and there's often alcohol and they may be indoors if it's hot. So again, there's a lot of things we can do to decrease the risk. But a lot of these predictions that various people have made in the past, such as 10,000 people being dead in Australia from COVID by May, have not turned out to be true. They get the headlines,
thankfully,
but that actually is not what happens. And I think it's very unlikely that we'll get the number of cases that were predicted in those headlines today. Look, none of us can have a crystal ball about this, but relatively the data so far suggests this is under control. It's a cluster. There's not uncontrolled community transmission like was occurring in Melbourne during their winter. So one would expect that this will be brought under control and numbers will taper down over the next 5 days or 10 days at the most. It should start being effectively zero.